Hi friends, welcome to Pharmacology 2.3. Today we are discussing about the topic antidiarrheal agents. So before going through the drugs that are used for the management of diarrhea, we should have a correct idea about the condition diarrhea. So we know that it is an abnormal condition. Here, the passage of unusually loose or watery stools at least 3 times or more in a 24-hour period can be seen in a person with diarrhea. Diarrhea can be classified into two. They are acute diarrhea and chronic diarrhea. Acute diarrhea, it is a condition that is caused by an infectious agent, while diarrhea that persists for more than 30 days can be termed as chronic diarrhea. In case of chronic diarrhea, finding out of the exact cause is very important for the effective management. Management of diarrhea. The following categories of drugs are used for the management of diarrhea. They are oral and parenteral rehydration, anti-motility agent. Usually we are using opioid category of drugs like codeine, loperamide and diphenhydramine. Third one, anti-secretory agents. It include resveratrol and octreotide. Fourth one is probiotics and the last one is antimicrobial agent. ORS, oral rehydration solution. In case of acute diarrhea, it is important to maintain water and electrolyte balance with proper fluid replacement. ORS seems to be simplest, safest and least expensive method to treat chronic and acute diarrhea. According to World Health Organization, ORS contains the following composition. It consists of sodium chloride of 2.6 gram, potassium chloride of 1.5 gram, sodium citrate of 2.9 gram, and glucose of 30.5 gram. These ingredients are accurately weighed and mixed with 1 liter of solution. The osmolarity value of this ORS, that is oral rehydration solution, is about 245. We know that during diarrhea, there will be a change in electrolyte and water balance. So in order to correct it, we use the ingredient like sodium and potassium salt in ORS. They are administered to replace their losses. Citrate is used as a base to correct acidosis. The World Health Organization recommends the use of zinc supplement for 10 to 40 days with ORS in acute diarrhea in case of children. Anti-motility and anti-secretory agent. It includes the drug like codeine. So from the heading itself, we understood that these drugs act by either decreasing the motility or either decreasing the secretion. So codeine is a category of drug that decreases GI motility, hence they produce constipation effect. The next one is resveratrol. Resveratrol is an anti-secretory agent. It is available in the form of a prodrug. When we administer, it gets converted into an active metabolite within the body and is usually inhibit encaphalinase inhibitor. Okay, it gets converted into an active metabolite and it inhibits encaphalinase enzyme, thereby it inhibits the degradation of enkephalin. Due to the increased concentration of enkephalins in intestinal mucosa, it decreases the intestinal secretion. Thereby, it shows antidiarrheic effect. The next category of drug is probiotic. So, before going through probiotics, we need to know that our intestine consists of natural flora. They help for the proper digestion. In case of absence or lack of this natural flora, there is a chance of occurrence of diarrhea. So we provide this natural flora in the form of supplements. So probiotics consist of microorganisms, either bacteria or yeast like lactobacillus and Saccharomyces. They help to maintain flora and health of the gut. The probiotic can stimulate immune response in the gut. The last category of drugs that used for the management of diarrhea is antimicrobials. Antimicrobials is not most commonly used. It is used in case of acute bloody diarrhea. Rifaximin is one of the example of antimicrobial agent that is used for the management of diarrhea. It is usually used for the treatment of traveler's diarrhea and also to prevent hepatic encephalopathy. So friends, I hope you understood the video. Please subscribe my channel. Thank you.